In this last video on cardiovascular physiology, I just want to talk a little bit about the heart from a more phenomenological perspective, not just looking at it as a pump, but looking at some alternative viewpoints, and then how we might integrate those ideas with Chinese medicine. So from the pump analogy of the heart, we of course have the contraction phase of the heart, systole, and the relaxing phase, diastole. And we talk about how the systole really is going to promote the ejection of blood from the heart, maintaining the arterial system, the oxygenation of tissues, and so forth. And diastole is more related to the venous side of the heart, the more filling of the blood, the relaxation in diastole, and so forth. So we're looking at more the physiology and how it's affecting your metabolism and so forth. But we also have to think about how are the organs related to what we might call our soul life, our feeling life. What's the connection between the heart and our inner feeling life? And is there any relationship between systole and diastole with the feeling life? Well, it's interesting to think about how with each systole, with each heart contraction, in a way, by encouraging the arterial system, the more catabolic, animal-like side of our blood system, we actually increase consciousness a little bit. I can think that during systole, we become awakened a little bit more. And so one perspective would say that we actually incarnate, in a way, our animal-like qualities as well as maybe our human-like qualities, but definitely our more animal consciousness qualities are incarnated more with systole. In the language of Western esotericism, that body of animal-like forces that really carries our soul life is the so-called astral body. In Chinese medicine, it's called the Hun. So we can say during systole, we incarnate the Hun a little bit more with the body. We connect it with the physiology more strongly. Versus in diastole, there's a relaxation. The Hun and the astral let go. We become a little bit more sleepy in diastole. Now, of course, we don't normally notice this, but between the systole and diastole, it's more the relaxation phase. Remember, that's when the parasympathetics really kind of kick in more during the resting phase of the heart versus the sympathetics, fight or flight, are more active in the systolic contraction phase. So this body, so the underlying physiology becomes more accentuated during physiology. And that body of living forces in the Western esotericism is given the name of the etheric body, versus in Chinese medicine, that's known as the Po. So the Po etheric becomes more predominant in diastole. Remember too that in the arterial system, especially during the contraction, we have a pulsating of blood. So the blood is really pulsating with a rhythm through the arterial system, versus in the venous system, it's more flowing sap-like, like in a plant. So you can think of systole as more our animal-like phase, and the diastole is more our plant-like phase from a different angle. Now, something has to mediate those two. In fact, remember during the isovolumic ventricular contraction, the volume of blood in the heart stays the same. In fact, the flow of blood comes to a brief rest. In fact, the only place in the body where the blood stops in its flow with each heartbeat is inside the heart during isovolumic ventricular contraction at the beginning of systole. Uh, Even in your vascular beds, the blood does not stop flowing during that phase. It keeps pulsating and it's constantly being injected at a constant pressure into the capillary system, into the microcirculation. So there's always a constant flow going on there. But in the heart, the blood actually stops for a moment. And, we can think of that from a higher perspective. Whenever you get a break in a rhythm, it sort of brings us to a different level of consciousness. Kind of like when you're just feeling around in the dark and you're not really aware of your surroundings, and suddenly you bump into something, you meet resistance, you stop your normal flow of movement, it gets resisted, and then you wake up a little bit to, oh my gosh, I'm in a room, there's other things in here. Same thing happens with each heartbeat. There's a contraction, relaxation, and a stoppage briefly in between of the blood flow. And that is where, in some traditions, they speak about how this is where the spirit can enter a force in us that's actually higher than our living forces, our Po, higher than our animal forces, our astral. It's our spiritual forces, and that is known in Chinese medicine as the Shen, and the Western traditions, the I or the I am forces. But these forces of self awareness, not just consciousness or awareness like in the astral sense, the animal sense, but self-awareness, self-consciousness arise possibly because we have that break in the physiology. So again, looking at how we can trace a soul spiritual activity all the way down into physiology itself. So we can think of the Shen in the Chinese sense as mediating systole and diastole. We kind of get that sense in meditation, when you're caught up in your emotional life and all the daily things you could say we're living in our astral body. When you step out of that in meditation and you practice mindfulness, where you're now observing, looking in on that turmoil, that constant changing sea of emotions, but more observe it more objectively, you're engaging now in the Shen. And so in a way, we're sort of stepping outside of systole and diastole. We're sort of being able to regulate them. And interestingly, going back to the Heart Math Institute, their work, they found that when you do mindfulness and you're able to observe your emotional life and not react to it, then your heart rate variability goes into that coherent state. So we start getting a very coherent heart rate variability. Unlike the erratic heart rate variability we see when you are just stuck in your emotional life and are just reacting to everything that comes up. So we could say the Shen activity can actually help when we engage in that, can help actually bring the relationship between systole and diastole and to better accord. So we can actually help to find a balance between them. So that's how we can maybe open the door to looking at how the soul spiritual elements actually tie in with the heart rhythm itself. The other important thing to remember here is that the heart, the cardiovascular system, well, we'll just focus on the heart here, is really sitting between your nerve sensory activity and your metabolic activity, which are kind of focused at either pole, your head pole, or your lower, your abdomen and your limbs in the lower part of the body. So the heart and the lungs really stand as balancing organs in the middle here. And going back to the threefold perspective I introduced with physiology, we can think of these as organs of rhythm, organs of balance that really balance the forces between consciousness and metabolism. Again, it'd be another way of saying balancing your animal-like qualities with your more plant-like metabolic qualities. You bring them together. So this sort of puts the heart in a different context from just being a simple pump. It actually has a role to play in your soul spiritual life as well. So the modern physiological view is that the heart is a pump, and it's kind of analogous to a mechanical pump. So basically, the idea is the heart really pumps all of the blood through all the blood vessels, and the blood circulation is really just a closed loop, and then the heart is inserted in that loop. The two halves of the heart, the right and the left heart, really act as two separate pumps that really pump through either the arterial systemic circulation or the pulmonary circulation. And the heart is able to produce enough force to actually push all the blood through those vessels. So that's the modern kind of physiologic view. Now, I'll get to some of the problems with this view, but one of the very first things that strikes us, if you actually line up again all of your blood vessels end to end, they comprise about 60,000 miles in length. So essentially the heart is pumping in terms of systemic circulation through a 60,000 mile pipe. Now you can imagine that the amount of internal friction and whatnot in a 60,000 mile pipe is tremendous. And so it would mean the pump itself would have to be enormous. So we'll come back to that little problem here in just a moment. This view, of course, in Western thinking arose from the work of William Harvey, who in 1628 first suggested that the heart is what moves the blood. Before that, it was actually thought there was a process where the blood, as it went to the head, was cooled off, heat was removed from it, and then it actually fell down into the body, and then it would circulate around. So all of your organs participated in the movement of the blood, and it wasn't the heart so much that moved the blood. He also was the first to suggest really that this blood system is closed. There's actually others before Harvey that suggested that, but he kind of outlined how before Harvey, it was thought the blood left the heart through the arteries and then just all entered the tissues. There was no closed capillary system and just sort of spilled out the tissues and then was taken back up by your veins to go back to the heart. But around the time of Harvey, it really became clear that there were capillaries, and there's a system of closed system through which the blood traveled. Um, Otto Frank and Ernest Starling. This is remember the Frank-Starling mechanism. These are physiologists who worked out this idea of how when the heart volume increases, the total force of contraction on the heart increases to a limit. So as more blood fills into the heart is able to pump more strongly. And so that was all sort of along this idea of the heart is not just a simple pump, but it's actually able to hold larger volumes of blood and then pump accordingly more strongly. Arthur Guyton was an interesting physiologist who in the 1950s did experiments in cardiac output. And he found that cardiac output actually is not just dependent on the heart. Remember, we saw the equation cardiac output equals heart rate times stroke volume. And remember, the stroke volume depends on the preload, the contractility, I'll just abbreviate them, and then the afterload. And the preload is dependent on the venous return, how much blood comes back to the heart. And so what Starling found was that really one of the biggest determinants was this preload. And what determines preload was what is happening in those capillary beds we talked about in the very first videos on this series, how local tissue metabolism will affect how much blood actually goes back into the venules and then goes back to the heart. So for example, when you exercise, you increase oxygenation, you make more lactic acid and so forth in the tissues. And so what happens is the capillaries actually absorb more of all of those waste products, and that drives more fluid back to the heart.
So an increase in peripheral metabolism will increase venous return. That will increase stroke volume, which would increase cardiac output. So it has nothing to do so much with the heart, but rather what's happening in the peripheral capillary beds. So you begin to get a view, more nuanced, that it's really not the heart pushing the blood around, but it has a lot to do with what's happening in the capillary beds in the peripheries that determines the flow of blood. And this explains phenomena like when you exercise or you get anxious, your heart rate increases. By this definition, you would expect your cardiac output to increase, right? You'd say when you get anxious, every time you get fearful and your heart rate increases, you should be pumping a lot more blood in the body. And that's actually not true. What happens is because your heart rate goes up, if your peripheral tissues are not metabolizing anything, in other words, if you're not exercising, your stroke volume, the venous return actually goes down, and the stroke volume will go down, and so the cardiac output stays the same. So that would explain phenomena like that. So again, when we think of the heart, we have to really think that it's really part of the whole cardiovascular system. And, so it's at the other pole of the heart would be your capillary beds. And so they work as a polarity to keep balance in the body. Most of our medical devices today, though, kind of approach the heart. So there's a lot of cardiac appliances that try to help a failing heart. And they really try to treat the heart as a failing pump. So for example, pacemakers would be used to adjust the heart rate. So we can put electrodes in the heart that actually will trigger the electrical conduction, electrical activity in the heart at a regular rate. That's a pacemaker. There are mechanical devices to assist the left ventricle. Those are called left ventricular assist devices to try to increase the ventricular output. They're sometimes used as a bridge agent before a person can receive a heart transplant to keep blood flowing. And then there are heart-lung bypass machines, etc. Interestingly, none of these, we're not even close to an artificial heart, an implantable heart, that's mechanical. And some of the physiologists I've actually talked to that have worked on this said we really, because the heart is not a simple pump, because of these other factors like the tissue metabolism and so forth, it's not an easy task to create an artificial heart. So that's why the only treatment we really have right now for heart failure is cardiac transplant. We'll talk about that procedure in the pathology section. So again, with the circulatory system, we have our two systems, our low pressure system, and that would be the venous system where the blood is flowing like sap connected to your metabolic activity. And then there's a high pressure system coming through the arteries, very oxygenated, has that pulsatile rhythm, and is connected more to consciousness and nerve sense activity. So this one, the low pressure system is more parasympathetic, and the high pressure is more sympathetic. Think of low pressure more plant-like, high pressure is more animal-like. And again, the Shen sort of stands from our last discussion, but balances between them. So what are some of the limits of this pump model? So, the circulatory system, as I mentioned in the very first video, is not really closed except to red blood cells, platelets, and large proteins. So most of your plasma, white blood cells all leak out. So it's not really that much of a closed system. It's open. It's very dependent, like Guyton argued, on the peripheral metabolism. An increase in heart rate under all conditions does not increase cardiac output. Again, as I just talked about, like in the example of anxiety. So that that's sort of different from what a typical pump model would expect. And again, the venous return is one of your major factors here. And so the filling of venous spaces, which is based on your metabolic activity, is a major factor that determines that venous return. The volume of the plasma is actually renewed in your peripheral tissues about 80 times a day. So you're constantly making new plasma in the tissues. The liver is a major organ, but all your other organs participate in that, together with muscle and adipose and whatnot. All of that contributes to the plasma. So going back to, I said before Harvey, people thought that all the organs participated in circulation, and we're actually getting back to that view again in conventional physiology. So we have to look at the venous return as a big factor there. Another limit to the pump model is, again, going back to the idea of 60,000 miles of piping. If you were to pump a fluid of the viscosity of human blood, which is thicker than water, through a 60,000 mile tube, you can actually calculate the size of the pump you would need, and it's basically the size of a semi-truck. So not even close to the size of the human heart. So the human heart is not adequate to actually pump blood through all the vasculature. Again, it seems to be able to pressurize the arterial system, and so that's why if we sort of cut the aorta, we can see blood spurting out of the arterial system. That's the pressure that the heart builds. But the actual low pressure flow of blood, and there have been experiments done in different animals, we don't do these anymore, but 100 years ago, 80 years ago, where the vena cava was actually connected directly to the aorta, and it bypassed the heart. And of course, the animal would die because there's no oxygenation. But it was actually found the blood flow actually increased a little bit once the heart was bypassed. So the heart actually has more of a damming up, slowing of the blood flow, and pressurization of the blood versus a direct moving action on the blood. So a more fitting image would be to say that the heart is actually moved by the blood, that it does not move the blood. And this is really coming into alignment with the findings of modern physiology. So another view is that the heart is not so much a simple pump, it's more analogous to what we might call a hydraulic ram. In a hydraulic ram, this is used on some farms, for example, to pump water. What you need is a water source, like a little river or stream, that's under low pressure, that comes down a hill, for example. And then let's say you have a water tower way up here you want to fill up with water. Well, one way to get the water up would be to take an electrical pump and pump it up. But you can also design this device where the water goes into a chamber. It actually pressurizes the chamber, then a little valve closes, and then that pressure shoots the water up a line to your tower. And so there's a special sort of little valve that has to be in place for this to happen. And that's called a hydraulic ram. So it uses no electrical power. It uses just the energy of the water in the stream to effectively, this is a low pressure system, pressurize it in the chamber. Just the weight of the water will cause the pressurization. And then it's pumped up a tube, maybe stored in a tower where then it can be used for your water supply. So if your house is down here, you can bring the water down. It just flows downhill. So this is a standard hydraulic ram. Now we can think of the heart is doing the same thing. So this low pressure venous system coming in gets essentially pressurized in the ventricular chambers, and then it is pushed out And so what comes out is at much higher pressure. But the important thing about a hydraulic ram is that it will not work if you don't have this steady flow of water to start with. And the same thing with the heart. If you stop the flow of blood to the heart, you will stop the heart basically. And this is known with like heart bypass machines. You basically cut the flow of blood off to the heart and it stops beating, and they can work on the heart. And then once you restore the blood flow to the heart starts beating again. So that's more analogous to a hydraulic ram versus a simple pump. Now, we don't have a lot of time to go into this theme in detail. There's some problems with the hydraulic ram model as well, but it's a little bit better than the standard pump analogy. But Craig Holdridge edited a really nice collection of essays in the dynamic heart and circulation. Many of these are by medical doctors who look at some of the data and kind of argue, again, the heart's not a simple pump. It has other features. And then a cardiologist, Branko Furst, wrote this really great book called The Heart in Circulation, an Integrated Model in 2014. And this really summarizes a lot of the research around that. Going back to the heart embryology, I mentioned that the blood flow actually begins before the heart actually beats at day 21. So about a day before that, we have a flow of blood through the forming cardiovascular system in the embryo. But the heart is not pushing that around. It is being driven by basically metabolic forces in your periphery. And we're beginning to realize what some of those forces are. One of the very unique things about your endothelium, remember that's the lining of your capillaries, is that they are lined with sulfate anions, which creates a negative charge. So the inner lining of your blood vessels is negatively charged. So are your red blood cells. They have a negative charge. And as the red cells go through your capillaries, they sort of are prevented from sticking to the walls by repulsion by those negative charges. So that's one feature. But another very interesting feature is if you just take a pipe and you electrify the inside of it. So here if I have a pipe and I create the inside, put a negative current on the inside. If I now pass let's say a little sphere, like a plastic sphere, which is also negatively charged, if I just put it at one end of that pipe, the way these forces interact will actually cause that little particle to propel through the pipe without any additional pumping or electrical current or anything. Just the electrical charges will draw the particle through the pipe. And this is called the streaming potential. So one interesting way to think about your capillaries is the negative charges on them will actually draw things through and will actually cause everything to flow through them. So in other words, the capillaries create their own flow, and that's independent of the heart. Of course, all that's going to collect into your venules, and then that's going to go as a low flow back to the heart, which then will pressurize it in your arterial system, and then it completes the loop. So this is another interesting little take on it, that the electrical properties of the capillaries and whatnot are helping to drive the blood flow through them. And they might actually be creating the blood flow itself. One final aspect of this picture is that the major source of this negative charge is sulfate, SO4, 2-. And the way the body actually delivers sulfate is essentially via two molecules. So one of them is an adrenal steroid. It's called DHEA, and it basically gets sulfated, so SO4 attaches to DHEA. This is made in your adrenals, and then it goes into the blood and essentially delivers sulfate to all your tissues, like your blood vessels. And that's going to help them get their negative electrical charges. So that's one way we get sulfate around. Interestingly, another way we get sulfate around is through cholesterol. Now, DHEA is actually made from cholesterol, but cholesterol itself can actually shuttle sulfate around. And so some have actually argued that the reason we see elevated cholesterol in heart disease often is not that it's a causative factor, but rather that it's the body attempting to deliver sulfate around to the tissues to improve their charge so that the blood flows through the vessels more easily. In fact, in traditional medicines like Chinese medicine, a discharging of the endothelium together with the loss of things like the nitric oxide we talked about earlier and prostacyclin, PGI2, etc. All of these different things result in what we can call blood stasis in Chinese medicine. So we might say that the cholesterol is trying to deliver sulfate to prevent blood stasis. And what do? We go in with medications to try to block the cholesterol, which could potentially worsen the situation. Now, I'll talk about the controversy around that with cholesterol when we get to the pathology section, but that's something to keep in mind. A researcher who's done a lot to put all these ideas together is Stephanie Seneff. I have her reference here. She has an interesting paper you might want to read called A Novel Hypothesis for Atherosclerosis, that's the plaque formation in arteries, as a cholesterol sulfate deficiency syndrome. So she argues if your diet is very low in sulfate, in other words, a lot of vegetables like brassicas and whatnot have a lot of sulfate, but not a lot of people eat those. If you're very low in sulfate, the cholesterol that the body makes will not have the sulfate on it, so it will be more, it'll promote more the plaque formation and whatnot. Whereas if we improve the sulfate, we could actually theoretically decrease that. So that's an interesting idea, and I've actually applied that to some degree, increasing sulfur foods and potentially supplements in some patients with heart disease with some interesting results. So that's is one potential approach there. But the idea of the kind of biophysics and the electrical activity is something important to keep in mind for what actually creates the flow of the blood in the peripheral tissues. So, wrapping everything up, we see the heart stands between our consciousness forces and our metabolism. We can think of every systole as maybe an incarnation of those consciousness forces. Every diastole, those consciousness forces leave and we get more metabolic forces emphasized. So it kind of mediates between the nerve sense and metabolic activity. We can think of the heart as not the driver of the blood, but it's more driven by the blood. The blood flow actually originates in the peripheral capillary beds. It's dependent on your organs as well. So all the organs, the liver, the kidneys, the lungs, all participate in driving the blood to the heart. And then that venous return is what actually helps influence cardiac output. So that's one aspect of the heart. It's more of a mediating organ. It helps to mediate your upper and your lower poles in that sense. It's also, the heart has a real sensory role, and I didn't talk about that as much, but I mentioned a bit about the mechanical, the baroreceptors and the chemoreceptors and whatnot. But the blood, the chambers of the heart are actually sensing the blood, and they're helping to integrate that information with the nervous system, and that helps to coordinate all the activity in your cardiovascular system. So the heart really adjusts what the cardiovascular system is doing everywhere. We can think of it as the head or the central regulator of your whole cardiovascular tree. So it has a nerve sensory-like function to integrate the whole cardiovascular system. One way it does that is through, I just briefly mentioned the fact that your atria and your ventricles secrete hormones, and that would be the atrial natriuretic factor, ANF, and the ventricular or brain, BNF, natriuretic factor. So as the blood volume increases, the heart secretes, the atria secrete ANF, that gets into the blood, and that tells your kidneys to begin to diurese, to push off fluid. So that's an example of heart-kidney connection, communication. But in a way, we can think of the heart as really standing at the head of your whole cardiovascular tree and helping to regulate it through all these different mechanisms. Now, again, the cardiovascular system, by delivering oxygen and nutrients to tissue, will directly affect tissue metabolism. And that is going to affect things like your warmth and so forth. So we can think of the cardiovascular system as the regulator of your body's warmth overall. Most of your heat, remember, is generated in mitochondria, and tissues that are very rich in mitochondria would include your heart muscle, but also skeletal muscle. And so the more oxygen and whatnot goes into them, the more heat we produce. What's very interesting is there is no cell in the body, human body, that is estimated to be more than 3 cell widths away from a capillary. Versus there are, areas where nerves don't get even close to different cells. So the nerves are permeating the body a little with less density than the capillaries. And we kind of get a view of that looking at like the Body Worlds exhibits where they take the plasticine and they try to get an image of all the blood vessels. And you find that every organ, every structure in the body is just perfused with all these blood vessels. So in a way, the cardiovascular system, if we ask what is the system that integrates everything, that holds you all together, it would be the blood cardiovascular warmth system. And going back to what I spoke about with the soul spiritual connections, what mediates the balance between systole and diastole and whatnot, that would be this idea in Chinese medicine of the Shen. So we can think, what is it that sits into the cardiovascular system? It's the Shen. And this would be your spiritual core. So what is the physical image of your spirit? It would be the warmth that we see is maintained by the cardiovascular system. So think of the cardiovascular system as the regulator of the warmth body. Again, in traditions like Chinese medicine, we talk about the cardiovascular system as a whole. We say that that is just heart. So when you say heart in Chinese medicine, you're not referring to the actual heart organ. You're really referring to the whole cardiovascular system and what I just spoke about in terms of its warmth regulation. We now have technologies where, at least on the surface of the body, we can't see the core temperatures, but we can see surface temperatures, which gives us an image of what all the capillaries and arterioles are doing on the surface of the body, and we can see how that warmth is distributed, and if there's any asymmetry. So in this person, the symmetry is good between both sides, but in some people you see like a lot of red over here, maybe cool colors over here, indicating more heat, more vasodilation, hyperemia in this area. And it's very interesting that needling and acupuncture, again, the proposed mechanism would be by influencing your autonomic system, would help to change the perfusion of blood into different areas. And that can help with speed up recovery and things like that. So that's kind of from a phenomenological angle how we can think of the whole heart cardiovascular system. It's really the organ system in which the Shen, your spiritual core, sits into and helps to regulate all of your tissues, all of your organs, all of your inner functions. Finally, for Chinese medicine, I'll just make some potential correlations between the so-called heart functions in Chinese medicine and the potential biomedical correlations. Again, in Chinese medicine, the heart is connected, is really part of the whole cardiovascular system. So it's not just the anatomical heart, but the whole, venous, arterial, capillary tree. Also, interestingly, the heart channel in Chinese medicine, there's a deep channel that connects the heart to the face and the eye, as well as the tongue. So there's this deep heart channel that connects. Anyway, so if we look at the heart functions, and this is summarized in Macchioccia, for example, the heart is said to govern the blood. And there's two aspects to that. One is the transformation of the food essence, the so-called gu qi, into blood. And then the other is the regulation of blood. Well, we can think of this, blood is made in the marrow, so the heart doesn't have any sort of direct role there. But possibly, the connection with the pulmonary circulation where oxygenation is happening. We can say we're creating the true qi that has to go through the body by the combination of all the nutrients in the blood together with the oxygenation of hemoglobin. So that could be one aspect of that. The heart also regulates the circulation, obviously. So as I just talked about, the heart is the master regulator of all the circulatory system. And that's where the autonomics and different hormones play in. Manifests in the complexion, we can think of that as the regulation of blood flow through the skin. So through vasodilation, vasoconstriction. Houses the Shen. Well, that relates to what I just talked about, how the Shen, the eye, really can be seen as sitting into the cardiovascular system. So it's really is the home for the Shen. No direct biomedical correlation there except through everything that I just mentioned with some of the correlations. And then controls tongue and speech. Again, no direct biomedical correlation. We can often see cyanosis with heart failure and that sort of thing on the lips. So that's one potential connection. But it could be through the autonomic system and whatnot that we're maybe talking more about there. And then controls perspiration. Well, that makes sense with thermal regulation and the diaphoresis aspect of circulation we talked about. And then finally I added here the regulation of warmth, which would be related to the perspiration, but really regulating how the warmth is distributed throughout the body. So if we look at heart physiology in Chinese medicine, we have disorders of what we can say the heart yang, disorders of the heart qi, and disorders of the heart blood and yin. And I'll combine those two because they're often considered the same. So we can think of mitochondria really as regulating the heart yang, and this would be the ATP production and the inotropic effects on the heart, so the heart contractility. That would all be part of heart yang. So cardiac contraction, so the calcium uptake, the sodium channels, and then the inotropes we talked about. A lot of the heart yang tonics, interestingly, have a positive inotropic effect. So that's an interesting thing. In fact, digitalis, which I talked about as a digitalis purpurea, the digoxin is a positive inotrope used in medicine. Well, digitalis is classified in traditional medicines as a heart yang tonic. Heart qi would be the electrical system, so that would be primarily the sympathetic parasympathetic systems. So remember, with sympathetics we get increased heart rate and contraction, parasympathetics decrease heart rate, and then heart rate variability can be a measure of the balance. So we can think of heart rate variability as one measure of heart qi in that activity. So this would be more related to the chronotropes, and a lot of those are heart qi tonics. And then finally, the blood and yin could be likened more to the heart hormones as well as the endothelial and endocardial function. So those different things like the prostacyclin, nitric oxide, all of those things could be related more to the blood and the yin aspect. So any problems there would be like blood stasis and so forth. So that's one way we can make some of the correlations between the physiologic, Chinese physiology, and in biomedicine. So that wraps it up for cardiovascular physiology. In the coming videos, we'll dive into different cardiovascular pathologies.